I agree, everyone. I just wanted to make a quick recording, a synopsis of the discussion we had last night. And I'm going to try to do this every week to make sure, just in case you might have missed anything or you wanted to catch anything. So last night was pretty much just an introduction, but I kind of really want to do this going forward when we really start getting into the different disorders, and then when we really start getting into the treatment planning models that we're going to be discussing. Okay, so real quickly, um, we in advance psychopathology lecture was a topic that is absolutely essential to all clinicians, especially clinicians of color, to understand the history of racism and sexism in psychopathology and mental health. And this is not just history; it shapes the biases of the diagnosis and the treatment disparities we see today. And so we kind of started off talking about how in the 18th and 19th centuries, early on, when so-called scientific studies claimed that things like intelligence could be measured by skull shape. And I really didn't get into this too much, but this is the kind of start of the eugenics movement. And these theories rank races in hierarchy. Well, with white Europeans being at the top, and we use this to justify slavery and colonial oppression. And women also was considered biologically inferior, and their intellect was questioned, and their emotional life was made pathological, right? So through concepts like hysteria, we briefly talked about and how in 1851 Dr. Samuel Cartwright created the diagnosis of drapetomania, and it was a supposed mental illness causing enslaved Africans to run away. And his recommendation for treatment was beatings, whippings. And this is an example of how psychiatry was used to uphold slavery and white supremacy and post emancipation. And the segregated psychiatric hospitals institutionalized thousands of African Americans in deplorable conditions. Um, Sexism in psychiatry is like women was treated for hysteria, and that's where histrionic kind of came from, and the term the psychiatric disorder or the personality disorder of histrionic is basically that a woman uses um, her sexuality as a weapon to get the things that she wants, and almost like what you would call quote unquote a drama queen. Um, in the 60s and the 70s, schizophrenia became the black man disease, particularly those involved with the civil rights movement, whether it was programs like SNCC, the Black Panther movement, Nation of Islam, uh, the this Southern Leadership Council with Dr. Martin Luther King Jr. Um, it terrified white America, and so what they did was that any black person that looked at life as oppressive and wanted to rebel and fight for it, they had kind of tried to do their best to classify them as being scary and being part of a mental illness. Um, when it comes to things like, and it's something we didn't really talk about, but briefly we get in touch with it, but the whole concept of intersectionality and modern biases. And what intersectionality is that when you look at a person's whole dynamic, a lot of times we just look at race as the key thing or gender. But intersectionality, when you combine different demographics of a person to look at them as a holistic. So, like a black woman, you look at her not only being a female, but you also look at her race being black, right? Then you might even throw in um, culture. So whether she's from the Caribbean, or she's from America, or she's from Canada, or from Africa, or she's from Europe, what that part of that culture has, what does that have to do with it? What other ethnicity have to do with it? And you look at even when you look at our um Latino brothers and sisters, when you look at the fact that it's like we classify them as, oh, they're Latino, but you got to look at it to where it's like, are they male or female? What's their culture? Are they Mexican? Are they Puerto Rican? Are they Cuban? Are they Venezuelan? So those things come to context the way they see the world, and that's more how you look at intersectionality, how all those intersect to help to see the person's worldview. And we looked at how trauma related disorders and or are under and overdiagnosed with psychiatric disorder. Um, when you look at the trauma that people who are being oppressed go through, that can manifest itself to look like different types of disorder. And sometimes these disorders are overdiagnosed. You see a lot of young people in school getting diagnosed with things like ADHD, and I'm not saying ADHD doesn't exist. I'm not saying that. But what I'm saying is sometimes that can be sometimes they're showing symptoms that look like ADHD, but really it's symptoms of trauma. Okay. When you look at different things that's happening within the communities, you have people, reacting to trauma on different levels in different ways. So those are things that you can look at when you looking at your diagnosis, and when you have cultural stereotypes like the strong Black woman or the angry Black woman continue to influence our clinical judgment. And so we have these biases toward Black women that can, impact the way we treat them, and that implicit bias can impact how they're diagnosed. Okay. Um, so understanding this history is not about shaming the field, it's about being responsible and having responsibility. We must ensure our diagnostic tools, treatment plans, and therapeutic relationships are informed by cultural humility, understanding the person's culture, understanding our own biases, having historical awareness, and a commitment to equity. And in your clinical practice, I want you to always remember that you are not just treating an individual, you are also navigating a system with a long and complicated history. Okay, so I just wanted to touch base with everyone on that, and I will see everyone next week.